Let's talk about 10 tests that you should have every time or once a year at least you have blood work done that could help save your life if you know about these particular tests. You can talk all you want about biohack this or biohack that. If you don't know what your biochemistry is, how do you know what you're hacking? Makes sense. So, pretty much the blood tests I'm going to suggest, with the exception of one every single laboratory in the country does. The very first one is called a sedimentation rate, one of the oldest and cheapest evaluation tests of inflammation in the body general. You want to know if there's inflammation because pretty much every single major disease does cause significant inflammation and problems because of it. And the treatment is often related to taking care of that particular inflammation. Number two is something called C-reactive protein high sensitive. Now, C-reactive protein high sensitive looks specifically at an enzyme from the liver that would tell you if there's inflammation that's occurring in the vascular system. That's your arteries and also your veins. Think about it. If we have the SED rate on one hand, talking about the body in general, and we have this test called C-reactive protein high sensitive, talking about the inflammation that's in your coronary vessels, we can sort of discern where there's inflammation coming from. If it's coming from one source or the other, or maybe perhaps both, or spilling over to both. Without these two tests, you won't know. And they're easy, simple tests. The third is called a PLAC2, some call it a plaque 2 test. It tells you if there's friable plaque in the arteries, meaning plaque that could easily break off and get caught in a smaller artery or a smaller vein. And this, of course, can cause a heart attack or perhaps a stroke of something of that nature. Now, friable plaque or plaque 2 test coupled with the C-reactive protein high sense, if both of them are elevated, increases your risk or doubles your risk of a heart attack and or stroke. You'd want to know this because there's so much that can be done to help prevent that from occurring. Number 4 would be the homocysteine level. Not long ago, it was considered, it's not some big deal. But those of you that know about MTHFR gene issues have realized that, well, the homocysteine is the outcrop of that. Homocysteine in the blood tells us if one of the major detoxification pathways is working properly. It's one of the major ways we get rid of toxins every day. Billions of times per second, we put methyl groups onto these different cells to get rid of toxins. And the elevation of such tests like homocysteine, making it higher than 6.5, give or take a point, starts to make the clinician realize, at least the clinician that's aware of this test, that specifically that there is a potential for you having difficulty in heart disease, cancer, and many of these other courses of problems. This homocysteine goes up, especially when the body can't detoxify. Can it be fixed easily? Yes. For the most part, the answer is yes. And so it's another test you should be looking at. The fifth is something called fibrinogen, often not done either by your family doctor or general internist. Fibrinogen is a good method of knowing if there is hyperviscosity, thickening of the blood. It can help you determine if there's what's called a microcirculation disorder, the tiny little hair-like structures which make up about 80% of the vascular system and the vascular tree, which where blood is let off into the tissues. In every single tissue in the body, you want that be able to leave the nutrients and oxygen and then take back the waste material. How do you know? Well, there are tests, but one of the simple ones is getting fibrinogen performed to make sure that that is not starting to clog up and that the blood is not too thick. The next one is, of course, vitamin D. Many physicians now are doing vitamin D. You just need to learn to ignore, in my opinion, the lab data, which says if it's 30 or more, then it's okay. It's not. It really should be between 60 and 100. But you can make that determination and talk to your integrative doctor, your biohacker, your nutritionist, your health food store person, or whoever is trained and understands vitamin D well enough to help guide you on how much you need to get to that particular level. The next test is a magnesium red blood cell. Well, the magnesium, zinc, and potassium are typically inside of the red blood cell, not in the system. The red blood cell releases it into system to make sure that you always have enough in the serum or the blood that's roaming around. Why? Without magnesium and zinc, 400 different chemical reactions for each one of them would never occur. So there's no way to have life without having the proper ones. I've seen cases and had cases where people were told, I don't know why you have muscle cramps. And they've done a magnesium, but they did the serum, which is a very small percentage of the amount of magnesium in the body. Most is in the bone. We can't test that. But a fair or good enough expression of this is in the red blood cell. You have to specifically ask for a red blood cell magnesium and a red blood cell zinc because they're intimately involved in pretty much everything that maintains cellular health, and that's what this is all about. The 10th, and the only one that's not done by a typical lab, would be something called a CTC test, or circulating tumor cell test. It's considered what we call a liquid biopsy. Now remember, if there's nothing seen on a structural test, chest x-ray, for example, MRI, CT scan, PET scan, doesn't mean there isn't problems there. It doesn't mean that there isn't problems coming. But the best way, earliest way, is to get one of the typical, what we call liquid biopsies in the blood that look for circulating tumor cells. These are the cells that break off from the typical primary tumor, wherever it could be, roam around in the blood, and they're the ones that are responsible for metastatic lesions, the things that really cause problems for an individual. Yes, keep getting your CBC, and yes, get your complete metabolic profile, the thyroid profile, which is typically what's done. But make sure you have those inflammatory markers, those red blood cell markers we just talked about. Make sure that you are looking at tests to determine whether you detoxify well and do you have any of the plaque that can break off. It's not a matter if an artery is totally closed, or, for example, that if you look inside with a catheter and say, this is not closed that much that it needs a stent or a bypass. But if there's friable, inflamed plaque, even you don't have a lot of plaque, but this plaque can break off and get caught in a smaller artery, could spell real problems as far as we said, heart attack and stroke. Rewatch this if you need, and make sure that you take this list to your doctor. If one of your doctors or doctor that you go to is your PCP, you don't need this, I would ask 2 questions. Why don't I need it? What does this test actually mean? What does it tell you? And maybe then, if they don't give you an answer that makes sense from a physical or physiologic functional perspective, it may be time to look elsewhere for your help. I'm Dr. Ghen. Thank you so much for watching.